Hey there, welcome back. Or if it's your first time visiting, I'm Debbie. I'm a gadolinium deposition disease patient who is not a doctor, not giving medical advice. I just want to chat about gadolinium and all of the things that it is and isn't. It does definitely help your body glow in the dark, so a radiologist can take pictures or a tech can take pictures and they can see what's going on inside. But it also is a toxic rare earth metal that's retained in everyone. It's found in your brain, your bones, your tissue, and your organs. You're probably tired of hearing me say that if you've watched my videos before. But anyway, I'm here today to talk about the document called The Safety of Magnetic Resonance Imaging Contrast Agents. And if I don't look in the camera, I apologize because I'm reading some of this. I have some memory issues related to the first injection of when I got gadolinium-based contrast agent, and I actually lost my job, couldn't find my way to the dog park. You've probably heard the story before. It was devastating, life-changing event. I even wrote a book about it. Gadolinium deposition and toxicity, a life-changing event, humanizing a life-changing event. Myself and 24 other patients wrote a book. Our support group's grown to well over 13,000 people, and that's just one of many worldwide support groups set up with gadolinium patients, for gadolinium patients, managed by gadolinium patients, because no one wants to talk to us about gadolinium. So this toxic rare earth metal, there's a lot of research, and I'm so thankful that the databases are going to become public now. We can get to the research and try to reconcile some of this, because I think we have enough data to reconcile some of this and change how it's being used. But anyway, the biggest thing about it being used would be that I would love to see people get informed consent. I was injected 4 times, and no one ever mentioned gadolinium to me, ever. 91% of people in a patient support group say they were never afforded any kind of informed consent or documentation, a medication guide, or a consult. A lot of times the forms in the hospitals and different places, facilities that you go to, say they're going to inject a contrast dye and that there's this, that, and other things, and that the dye is really used to help you see inside the body, which is true. That is true. But they neglect to go to the next step and talk about the toxicity, the possibility of risks, and all of those things. So that's really not informed consent. Anyway, let's talk about this document. This document's published by Frontiers in Toxicology. The name of the document is The Safety of Magnetic Resonance Imaging Contrast Agents. And if I mispronounce words, I apologize. Part of it's a brain function problem, right? Have improved a lot since the original brain injury diagnosis, but I have had just a ton of new diagnoses since then, and we're still trying to figure out how they may or may not all be related. So let's move forward with this document. So it says that this document says they suspect nanoparticles are part of the reason that people are experiencing chronic toxicity. They talk about that this is a toxic rare earth metal and that it's used to enhance, like we already talked about. Then we talked about the CDC statement that says, even now it could be associated with significant, even in small amounts, significant morbidity and mortality. And so the document just goes on to talk about the nanoparticles, presents a challenge that part of it is we don't have a clear definition for this disease, gadolinium deposition disease. And that's hard because no one's testing. No one's talking about it. Doctors won't talk to you. They'll shame you. They'll bully you. They'll give you a hard time, and they'll even quit seeing you if you push the issue. But no one wants to talk about gadolinium. And I don't know why. It doesn't make any sense to me. Insurance pays to inject it. There's no cure. There's no antidote to get it out effectively, efficiently, safely, in a timely manner. But here we are. Okay, keep going. It was in 1997 that it was first recognized that it was causing fibrosis, right? And that is a recognized disease called NSF, nephrogenic systemic fibrosis. So this document talks about that the first cases were identified in 1997. It was actually a dermatologist, and it was problematic. So then they talk about after 1997, and I know a whole group of these patients actually went to an FDA hearing, and this is discussed in this book about this FDA hearing, and the FDA recommended that all health care professionals weigh the benefits and the risks associated with administering this drug, and they put a box warning out at that point. And the box warning was done in 2007, and I think there were some changes made, and maybe one version of the drug was actually taken off the market. I can't really remember that part, and it's not here, but it does go on to talk about there is a consistency between systemic fibrosis and the different imaging contrast agents. So the issue didn't really go away, but what we learned as patients and doctors and scientists and even the FDA and the CDC is that NSF, the first one we were just talking about that was diagnosed, that was had to do, or they thought it had to do with kidney function, but now we know kidney function's irrelevant to this whole thing with systemic fibrosis. And so this paper goes on to talk that there are multiple published reports about NSF, and then it talks about the different brands, and I'm not going to mention the brands just because there are multiple manufacturers who make different brands. There's Linear, and there's Linear, and there is I forgot. I had a brain fart here for a minute. Linear, and then macrocyclic. Thank you very much, macrocyclic. So they thought that they'd fix some of the problems, but if you go to the patient support groups, there's equal amounts of problems with macrocyclics or linears. But I'm not going to mention brand names. I don't want to get in trouble with any one particular vendor or manufacturer. But it's in this report, so you can read about this, and they talk about how it is causing still fibrosis irregardless of the brand name. So, and irregardless of kidney function. It talks about some of the symptoms are skin thickening, like hard rubber, hair loss, skin biopsies with fibrosis, abnormal calcifications on mammograms and x-rays. And that's kind of scary for women who are getting mammograms. Number one, they started injecting it to do mammograms and suggesting it be injected for mammograms because of dense breast tissue, saying that you can't really see what's going on with the breasts, but it's kind of scary that then they inject this toxic rare earth metal that's retained in the brain, the bones, the tissue, and the organs. So anyway, it talks here about the abnormal calcification on mammograms and x-rays are some of the symptoms that they're seeing with some of these brands, and it mentions the brands again. I'm not going to. The delayed manifestations imply that a minuscule remnant concentration of gadolinium, a second event, may be causative. So they're saying that that's really talking to the fact that if you have more than one injection, the symptoms, the manifestations of illness and disease may appear different. So anyway, it's kind of sad because we do have a lot of people in the groups that talk about fibrosis. And I had a lung fibrosis diagnosis last year, and then this year I got a heart fibrosis diagnosis. They're calling it heart thickening, but it's a fibrosis. It depends on who you talk to. And I'm actually going for a second and third consultation to figure out what's going on. It's always good to get other people's opinions and see what they think. But it did show up in imaging and on an echocardiogram, which was the imaging part of it. Then it talks about, this document talks about symptoms can take days to years to develop, which is scary because how do you know then? And that's where the studies are really missing. And this one doesn't really talk about that, but I will. And that we don't have studies and no one's tracking what is the correlation and the association 1 year, 3 year, 5 years, 7 years, 10 years down the road with ailments that a patient is experiencing. And did the original imaging with the contrast? Were they able to fix the original ailment, and then are patients happily, merrily along their way, healthy? Or are they experiencing some of these things like fibrosis 5 years later, 10 years later? And then why aren't we connecting the dots? And why aren't we tracking that? And why aren't we asking those questions? Because that's really how we're going to get to the bottom of this and try to figure it out, right? So anyway, does talk about acute kidney injury can happen years later, and that's kind of scary. And diagnoses can be overlooked for years. It talks about neurotoxicity, and I did a short clip on neurotoxicity because it is a real thing. It affects the brain, and I would just say that we see that in the groups with patients that we meet and talk to, and we help each other out. We're all just part of a community, a growing community, by the way. But yeah, neurotoxicity is a really big thing, and we used the Cleveland Clinic's list of what they consider to be neurotoxicity type symptoms, and we asked patients if they aligned with that and how they felt about brain injury and that kind of thing as related to what they were experiencing as patients. And that this paper talks about some of that. And even, I can't pronounce this word and I apologize. My brain doesn't work. I can read it and I know what it says, but encephalopathy, anyway, it just means brain injury. So they talk about that. There's like a whole big paragraph on that. So then we talk about complications, implications, dosages. Does that play a role? And they say that each dose of gadolinium is fraught with unanticipated risks. It's so scary. It's such a scary drug when you haven't gotten informed consent or a consult or a medication guide prior, and then you're injected and you get sick. It's just scary. Okay, so then it talks about the bone marrow, and the bone marrow has a memory for this drug, and that it seems to remember it, and that repeated exposures again correlate with more severe disease manifestations. So it just doesn't sound good, right? And I'm not trying to convince anyone to not get an injection. If you're sick and you just are looking for answers, a glow-in-the-dark picture is very helpful. But I think what's missing is, what does that mean after, years later after the glow-in-the-dark picture, especially when it's injected with no way to get it out easily and effectively. But everyone should have, as long as you have informed consent, you should be free to inject whatever you want into your body, right? I mean, but is a repeat customer model because you're sick after an injection helpful to anyone in society on a whole? Patients can't work, patients are sick, they're running to the doctor more frequently. We've done some studies, informal patient polls, and patients say that they go back to the doctor 5 to 10 plus times asking for help for new and unexpected, unexplainable concerns about their health after following having had an injection of this contrast dye, and they just are like at a loss, and doctors don't want to talk about it. So we talked about neurotoxicity, so let's move on. So it does say, regardless of the brand, there are the problems. They talk about it being a lanthanide. It's a F-block electron orbital element, which are not ever found in the human body unless someone's injecting it or putting it there. And we are seeing it in water, in the water-based cola products. That was like years ago. In Germany, they did some studying and they did see it. And we know that in the U.S., they actually have tested it going into the water system, coming out of one of the hospitals that do a lot of MRIs with contrast. So they're measuring it. So it is measurable. So will we normalize it? Will everyone eventually have gadolinium in their bloodstream, and will we normalize it? How will that impact health? I think those studies need to be done too. What is the mechanism that's, number one, setting off disease, and then number two, when does toxicity overload just take over? So then they talk about they're working with uh, mice and rats, which has always been the way, right? And there still goes on to talk about more of the injury related to fibrosis. This paper has got a lot of information related to fibrosis. And we know that other things cause fibrosis in the skin and different places too, right? Like this paper actually mentions rapeseed oil as being something that can do that, and mirror similar kind of characteristics of systemic fibrosis. So we shouldn't just completely say it's all gadolinium-based contrast agents, because right here it even talks about you need to be open to rapeseed oils, which we know aren't good for us, right? We're learning a lot. World's on fire, learning information overload for sure. So then it goes on to talk about sclerosis, and sclerosis that has to do with more like neuropathy, pulmonary hypertension, those kind of symptoms. And I would say we have a pretty good group of patients who do deal with neuropathies. Small fiber neuropathy is probably one of the very first diagnoses that patients see in the group. And I kind of wonder sometimes if the doctors aren't testing for that because of the pain associated. 88% of the patients in a poll, again, said that they have chronic pain, right? And so I think doctors are trying to figure out, well, what's the pain from, and is it related to the small fiber nerves? And the neurologist who tested me said that, and my test came back positive, unfortunately, but it did say that small fiber nerves are the most painful nerves in our body. And you can get neuropathies from a lot of other diseases. I know people with diabetes have neuropathy type symptoms and issues and diagnoses. So it's, again, gadolinium is not the only one associated with that. And that's what makes this so dang hard, is because you're injecting a toxic rare earth metal. So it's like chicken and egg. What kind first? Did you have diabetes? Did you have neuropathy? Did you have neuropathy from an injection of a contrast dye while you're looking for something else? We don't know. That's where the question, the $1 million question is right now. And I don't know how we're going to prove it. I'm not a scientist. I'm not the researcher. I just have to go along, and I do participate in studies, and I do try to provide data that is helpful, my medical records, my test reports, all of that, to try and help figure this out. Anyway, let's move on. So the paper does talk about that, talks about the cellular infiltration again, and then it goes on to talk about cytokines, and we know that's a problem. Then it talks about it's talking about sclerosis. It even talks about inflammatory breast cancer, all kinds of lymphatic obstructions, systemic sclerosis, dermatofibro, all these long fancy words, medical words that I'm not going to try and define or even pronounce, but basically just saying specific risk factors for solidary fibrosis tumors remains unclear. So I don't think we have enough research. And interestingly enough, we're doing a lot of new research came out of the University of New Mexico with Dr. Brent Wagner related to oxalates and how that might be associated with fibroblasts and all of that, and some of this. So, and they're looking at, the big thing is now markers, right? All these markers in our bodies and these genes, and how we have them all, but the marker doesn't get turned on until something turns it on, and what's turning on the markers. And it's fascinating. I wish I would have paid closer attention to chemistry in school. Anyway, so then they talk about gadolinium's exposure. It's really the exposure comes from, for inside humans, is when it gets injected, and it's the catalyst for toxicity, and it requires the ion to be tightly bound to chelating agents, which was once thought to be the case that it was tightly bound, but now Wagner's research on oxalates is asking the question, is an oxalate reaction, which we all eat oxalates, is that dechelating the ligand intended to protect us from this toxic rare earth metal? And if it's disassociating, then is the gadolinium free to move around in the body? We know that gadolinium is the same size molecule as calcium. So when it talks about the bone marrow, that makes sense, right? Because I can't remember the percentage, but there's a high percentage of calcium is in the bone marrow. And if gadolinium's competing with calcium, then it probably ends up there, right? So there's that. And it's funny because I talked to some scientists and really highly educated people, and they're always like, that's such a layman term, Debbie. That's not what it's all about. And then they try and tell me, and my eyes just glaze over it. I'm like, that is so confusing. I don't understand that. I'm the patient. I'm just sick. Can you just fix the problem? Moving on. I got to get this over with. So further creating new chaos, mineral gapping, patients with complications from contrast are migrating to providers giving untested therapeutics. So one of the things, there's no consensus on the diagnostic criteria for this, which we would agree, but that's because no one's really working on it, I don't think, or we don't know of who is. If you are, and you'll raise your hand, patients would like to talk to you. So there's that. And then it talks about the undergoing degradation of this toxic rare earth metal from the ligand. And so, yeah, there's a lot here, right? Okay, I highlighted this whole thing about the principle of the Trojan horse is that the nanoparticle cellular internalization initiates the toxic effects. And then it has a whole paragraph. So I'm just kind of sharing this document because if you're curious and you're worried about your own health and you're being scheduled for an MRI with contrast, you want to read these documents, and now they're available because the NIH made them available, or the Kennedy team, or whoever's on that team. Thank you so much. I don't know exactly who got that approved, but the research is available to you. So if it's on PubMed, you can research by the topic, and you can find all kinds of things to read before you go, because I'm not sure, until we get changes made to the informed consent and get that kind of standardized where everyone's getting consistent information about it being toxic, about it being a higher risk than what was thought, then we have to just be our own advocates. And I think as patients who have been poisoned, that's what we want to be, is an advocate for other patients, because we don't want people to suffer what we've been through. And that's just humans helping humans, right? That's not anti-pharma. That's not anti-drugs. That's not anti-healthcare. That's just kindness. Anyway, so then it talks about the mitochondria, and we know that. We have a lot of papers on mitochondria, but it does talk about mitochondria, tissue infiltration that causes inflammatory cells, and then an uptake in the brain neurons. And it was once thought it didn't cross the blood-brain barrier. And I have a timeline that shows when the research came out that did say it crosses the blood-brain barrier. And truthfully, there's, and I'm not an expert. I'm not giving medical advice. And I admit there's a lot of gaps that I don't understand because this is so complex. But once it was thought it didn't cross the blood-brain barrier, and then it was recognized that it does cross the blood-brain barrier. And then people started questioning, well, what does it even mean about the blood-brain barrier? And so then it goes into a whole different set of toxins that we all deal with on a regular basis, because we live in a toxic world, right? And our bodies are changing because of these toxins. We have inheritable things. We have the things we're born with, the things we get passed on from our family and genetics and all of that. But then we also have these toxins that we're introducing into our body, what we're injecting, ingesting, inhaling, and even putting on our skin, right? All those things are having an impact. So we have to get to the bottom of some of this. And I'm not so sure that a glow-in-the-dark picture is helpful long-term. I don't know. Okay, so risk is the product of severity and probability. And again, it's talking about brain injury and systemic fibrosis, and that they can be catastrophic. More often, acute reactions are reported. Yeah, this paper really doesn't present a very good light. And I would say if we had research papers and prognoses that were good 5 years, 10 years later, like we talked about a little bit ago, then we just need to see those. We just need we need access to those papers so we can do some comparisons and we can weigh the pros and cons and we can kind of get to a baseline of where we're at, because lots changed since this. So there's always, the last paragraph says there's always more than one side to the argument concerning the safety of magnetic resonance imaging contrast agents. Disinherited by the medical establishments, patients spend eternal time in chronic symptomatic purgatory. And I would say if you've had a reaction to gadolinium, that's probably really true. And severity is going to differ, right, for everyone. And maybe that's because it depends on where they're injecting it and what they're going to look at, and whether it's a bodily organ or just a muscle, or because we used to give patients used to say they were getting contrast for hip evaluations, and then pancreas or the brain. And so maybe it depends on the different body functions or bodily systems that the contrast is going in to be looked at, and then the magnetics pounding away, which is drawing the contrast to the place of injury so that they can see it, right? It's very complex. But anyway, it does say that patients spend an eternal time in chronic symptomatic purgatory. Escaping complications from a gadolinium administration is not a sign of providence. It indicates that there are undiscovered factors. There are many knowledgeable gaps concerning magnetic resonant imaging contrast agents, the biology of gadolinium, and the mechanisms of complications. There's a lack of effective treatments for iatrogenic gadolinium metallosis. Clinicians should be aware of the possibility of gadolinium toxicity even in patients with normal renal function. We talked about all those things, especially with intrathecal administration, which that's a whole nother topic. And there I watched a video, this was years ago, about five doctors from the Mayo Clinic said it should never, they did a testimony, and this is on video, I'm not making this up, 5 doctors from the Mayo Clinic, and they were talking about intrathecal injections, and they said don't ever do that with gadolinium, ever, period. That was their stance. And I'd be happy to, if someone pings me and wants that reference, I can provide that to you for that video and those doctors. Anyway, so then goes on, talked about that, the intrathecal. Then neurological symptoms following intrathecal exposure can be transient, resolving with attentive medical management, but can result in severe and potentially permanent complications. More research is needed to find ways to prevent or slow the progression of these diseases. Magnetic resonance imaging contrast agents cause kidney injury, and gadolinium, that word again, encephalopathy, encephalopathy, can sometimes be fatal and may lead to permanent gadolinium retention. Provider education regarding these known adverse events is critical, and informing patients of these risks and outcomes is essential. And it's sad that I'm on here doing videos, and the only reason I'm doing that is because the medical community is not. 91% in a recent poll said they were never afforded informed consent, a medication guide, a consult about the risks associated with this drug. That's not health care. That's not wellness care. That has to change. And I will always stand up for humans and patients, because no one should go through it. myself and a growing community are going through when it comes to being more sick, being more, getting new and worsening symptoms, unexpected and unexplainable diagnoses that had nothing to do with our original ailment. So please be safe, be aware, be informed, be an advocate for yourself, for your loved ones. I'm not a doctor. I'm not giving medical advice. I'm not even suggesting that you do or don't get it. I'm just saying education is knowledge. Knowledge is key, and health is wealth. And when you don't have your health, life changes. May your journey be one of wellness always. I hope to see you soon.